And welcome to the Dr. Bob Show. We have a great show lined up for you over the next 30 minutes. We're going to be talking about love handles. Would you like to get rid of your love handles or a little bit of too much poochiness right in your stomach without surgery, without liposuction? When you were 18 and when you were 20, did you get a tattoo and now you're wishing you never got it? How can that tattoo be removed? And do your hands get all sweaty before you give a talk? Or maybe you perspire too much under the arm. Can that be taken care of simply? How difficult is it without surgery? My guest is Dr. Meredith Overholt. Dr. Meredith Overholt is a board-certified dermatologist. She'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about chronic hoarseness. Could it be a sign of cancer? Could be, probably not. And Parkinson's disease. Why do people get that? Can it be prevented? What is the treatment? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Meredith Overholt, board-certified dermatologist, and we're talking about love handles and tattoos and what we can do about those. I'm pretty interested in love handles, Meredith, because I think I'm like most people. I've got love handles that I'd love to get rid of, and I exercise, and I don't do a very good job of getting rid of them.
That's right. There are often areas where even in the healthiest, most svelte, exercising sort of person, you simply have areas of unwanted fat that will not go away no matter how hard you try, usually using the usual and customary techniques.
You know, when I read the medical literature, we talk about a belt size being wrong with your health and it leads to more heart disease. The love handles that were there probably don't relate to that. What can we do about love handles from a dermatology standpoint?
Well, you know, the traditional answer has really been liposuction. And whereas that is a much better procedure now than it was originally, it can be done under a type of local anesthesia, it's still considered an invasive procedure. You know, just recently there was a report of several patients who ended up with group B strep infections, one of which died after liposuction. And that's just a barrier that a lot of people can't cross. So there's been a very big move in dermatology and in plastic surgery to move towards non-invasive cosmetic procedures.
Sort of non-surgery, not using the knife or the scalpel.
Right, and not requiring anesthesia or, you know, the sorts of things that worry people as far as, you know, increasing their risk.
So what about my love handles? What are you going to do non-invasively?
Well, there have been several different devices that have come to market over the last 3 or 4 years that are designed to use either a form of energy or, in a manner of speaking, the absence of energy, cold, to destroy fat cells.
So will cold do that? Can I cool down my side? What do you have to do?
Well, obviously it has to be given in a very particular fashion or you could actually injure the skin, so I don't want to hear about anybody sticking ice cubes on their sides. A Cool Sculpt laser is the one I'm referring to. And a Cool Sculpt laser is able to use what is called a transducer that's put on the skin and actually pulls the skin and unwanted fat underneath it up into it and is able to chill that to a specific, carefully limited temperature. Yes, that is, you know, fat actually dies faster at a lower temperature than nerve cells or blood vessels or that sort of thing. So as long as you cool it to this very correct temperature, you can kill the fat cells and not cause damage to the normal structures of the skin.
Would it hurt if you kill these cells? If you freeze the area, doesn't that hurt?
Well, you know, when the skin, I've had it done, and when you pull the skin up into the transducer, that's uncomfortable for a minute or two, and then when the device is turned on, it begins to get cold. And at a certain point, it actually becomes numb. So one sits there for about an hour to have the procedure done. And really, that is not bad at all. It certainly doesn't require any sort of anesthesia or pain pills or anything like that. When the transducer is removed, one has to massage the tissue, and that's a little uncomfortable too, but it really is a very short situation.
This is called cool sculpturing. Certain parts of the body that are better. You got the love handles. How about the little fat in front of the tummy, right under the tummy button?
Absolutely. That's a very popular area as well. And whereas the company that has really been FDA approved for those areas, they are starting to, there's a new transducer that will work on the outsides of thighs. One can do the inner thighs. We've even experimented with using it on calves and upper arms with some really nice results, although again, those are not, quote, FDA approved treatments yet.
So the best results would be the love handles and the thighs.
And abdomen. Well, abdomen, thighs not been done quite as much as yet, but I'm sure they'll get there.
When you do the freezing, does it immediately show a difference, or does it take a period of time?
It does take a period of time, because what you're actually doing is causing damage and death to the fat cells in the area, which then need to be resorbed. So the improvement occurs over about a 90-day period. It's gradual. It's really nice. There's not a drop off. When this happens, it looks very even and nice. Now, you were asking earlier about whether you could get a hole, and you really don't. But patients have to be carefully selected, because if someone is of an age or situations that would cause the skin to be somewhat lax. If you lose the skin underneath a very loose fold of skin, and the skin's not going to contract again, it's not going to look very nice.
So most people, most men that I see that have love handles, I would think that their skin has been stretched there, and if you kill the fat cells under there, it would seem like there would be some skin loosened. And
again, that has to do with how badly it's stretched, how old the person is. Usually, this is a device that works a little bit better in a 50-year-old or a 40-year-old than a 70-year-old, because once that loss of elasticity has happened in the skin and it's not going to snap back, then you're not going to have as good of a result. But if you've seen people who've lost 60, 80 pounds and they're in their 40s and 50s, and the skin just comes right back. So, so absolutely, if you've got good elasticity, and that's why patient selection is really important. This is not for weight loss. This is for people who are in good shape, practicing good health attitudes, but they just have stubborn areas that won't go, and it's just really a great treatment for them.
It's my understanding that if liposuction was done, where they would suck out the fat cells in liposuction, that the fat would come back if you continued to eat and not exercise. How about the cool sculpting?
Well, actually, in neither case. Once the fat is gone, the fat is gone. Now, if one chooses then to go and gain 40 pounds, that fat has to go somewhere else. And so you might have no love handles, but you might suddenly begin to develop fat in your arms, or fat in your legs, or fat in your back, or some other place where you don't really like it either. So again, that's why this isn't really for weight loss. It's for people who have a stable weight, who are really committed to good health and keeping their weight down, and they're not going to go off and go, oh gosh, my belly's gone, now I can go to the buffet over there.
Men or women?
Both.
Both of them. So what we're doing is we're freezing fat cells. Probably the younger the better. If you get an old fogey like Dr. Bob, it might leave with some lax skin.
Right.
But it sure does interest me, because those love handles are something that are hard to get rid of.
Right.
Patient satisfaction?
Very good, very good. I think, we've been doing it for a couple of years now, and I think we've had very, very good satisfaction.
Meredith, and people when they're 18 and 20, sometimes people get tattoos. Can tattoos be removed without surgery?
They can.
When I go to the beach, I see all sorts of young people with tattoos. And I say, oh, I bet they're going to, when they get to be older, they're not going to want to have those. What's the statistics?
Right now, better than 25% of the adult population of the United States has at least one tattoo, and over 50% of women.
50% of women have tattoos. And do most of those want to get rid of them? Some say it's okay, I can live with it.
The rate that's published is about 20 to 25% actually regret that they have done it and would like to have it removed.
I had a patient call me up one time, an allergist, and say, Dr. Bob says, I've got a tattoo on my ankle. If my mother sees it, she'll kill me. And she said, can you help me get it off? And I said, sometimes you have to suffer. Tell me, how can these tattoos be removed? Can you stain them off? What can you do?
Well, lasers have been traditionally the answer for this, and what I wanted to talk about with you is the fact that there is actually a new laser that's better than the previous ones. We've had lasers to remove tattoos for a long time, but whereas it would cost $100, $150 and 20 minutes to put the tattoo on, we could be talking 10, 15, sometimes 18 or 20 treatments that are very uncomfortable and very expensive to remove a tattoo. It can be less than that, but it sure can be up there.
So when you have to have 18 or when you used to have 18 or 20, each time you would come and they would go zap, 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 zap and try and burn it off?
Well, basically, no, to destroy the pigment within the tattoo, hopefully leaving the skin intact, because the idea would be to remove the tattoo without causing a lot of scarring. And I think the preceding lasers that we had that did that fairly well. One usually didn't scar, but one often would have an area of odd pigmentation, maybe lighter, dark, where the tattoo was. So it was fairly obvious that maybe something had been there, but that the tattoo at least was gone, and one could blame that scar on whatever they wanted to. Exactly.
So what's the new laser? What's the name of it? What does it do and what makes it better?
Okay, it's called a PicoSure. And a PicoSure laser is one that uses a new modality of speed. The pulse is in a picosecond, which is 1,000 times shorter than a nanosecond.
Whoa.
It's a thousandth of a second.
So it's just going to...
So, I mean, it is...
With a blink of an eye, and much less.
Much less. So when one uses energy that's that fast, one can target the pigment very specifically and produce a lot of energy at the level of the pigment, causing it really to be destroyed. And then the body will resorb that. So the average tattoo with the PicoSure laser, it takes about, I think their published study is 4.3 treatments is where I often see it listed, which is substantially fewer. Okay.
So if I've got a couple of butterflies that are the size of a business card that are tattoos, and some of them are green and black and yellow and blue. Tell me about the colors.
Doesn't matter as much anymore. That was a tremendous problem with the preceding lasers, is that and as a laser physician, you had to have a specific laser for each of the colors, which I can tell you is very expensive and difficult. So, with this one, it doesn't really matter the color of the laser. It's been able to, of the tattoo, it's been able to take out all colors with really pretty good success.
So if I've got a butterfly tattoo on my arm, how many treatments would it probably take to get it off?
Well, again, it's ideal for the smaller tattoos. It's a very unfortunate, when new lasers come out, unfortunately, they are extremely expensive. Okay, because they represent some really new technology that took a lot of research and development to create. What we hope is over time these will decrease in price, or new competitors will come to market with similar but not exact technology, and that'll drive the price down, because right now, if you were talking about that business card size tattoo, people are charging between $300 and $500 a treatment for that, and if the average is 4.3 treatments, you're talking about a lot of money
so it's
to get off. Might be
at least it could be. And if it was $2,000 to get rid of a tattoo, it would depend on your desire and the family's desire to get that off. You see these athletes with their whole body, total body tattoos, they're in trouble.
Yeah, well, hopefully they really like them, because that's probably not going to be an easy thing to do. But they are doing the ones that are the sleeve-like tattoos, and I've seen some before and after pictures, which are pretty impressive.
And with the Pico Sure, you get good results with the little small tattoos, and after 4 or 5 treatments, average, you can give it. I want to switch.
Okay.
How about people that before you give a talk, you perspire under the arm and your shirt gets wet, and you see all sorts of advertisements about people that are having deodorants and antiperspirants under their arm to keep the sweating from going.
Sure.
Tell me about the problems that you can have.
Okay, well, we refer to that as primary axillary hyperhidrosis. In English, that means that it's not all over. Some people sweat all over, or they have it in a single location. And so one of the primary ones that people have problems with is underarm sweating. And I'm talking about the type of underarm sweating that you put on a typical deodorant within an hour or two. We have people who will soak 5 and 6 shirts a day. They never go anywhere without extra clothing. It can be it doesn't kill anybody, but it is a tremendous social nightmare for them. And many of them, there's accompanying odor, and there's the fear that they're thought of as being unclean. And so it is really a tremendous problem. And there are been several treatments over the years that have been helpful, all the way from a simple solution called anhydrous aluminum chloride, or dry sol, that's applied to a dry underarm at night and washed off in the morning. It can be very successful for some people. For some people, it's not enough, or it can be irritating to the skin.
What was the name of that?
Dry sol.
Dry sol. Okay.
Popular
Aluminum
one.
sulfate?
Aluminum chloride.
Aluminum chloride.
Anhydrous aluminum chloride. And then other than that, there's something called a dryonic device, which actually involves sending an electrical current through the sweat glands. It works well. It's kind of a hassle. So that could be, and then Botox, which can be used with injections in the underarm. But all of these things are temporary. They have to be kept up with. They don't represent a conclusive sort of treatment. We've not really had a whole lot for that. There's a neurosurgical procedure where one can go in and actually clip the nerves that cause, especially when somebody who has anxiety-based hyperhidrosis, like you said, you can actually clip nerves there that can cause the sweating not to happen. Unfortunately, in some of those procedures, people have what's called compensatory hyperhidrosis. So they stop sweating here, and they'll suddenly begin sweating over here or over here. And if they get lucky, it's someplace that's a little more socially acceptable, but it can be a real problem.
Is there a newest and best?
And so now there's a newest procedure for this. It's a little too early to say that it's newest and best, but there is a new device that uses microwaves to transfer energy to the glands, sweat glands in the underarm, and is capable of destroying them. Okay. And it's got a very high success rate. Most people say about 80% of people get a really excellent response.
Wow. That can be life-changing.
It can be life-changing. And, at this point, it's hard to say something's permanent when it's only been out for a year or two. But I think when you've had somebody who's had tremendous problems and then they're in great shape for a couple of years, as you know, most tissue that's died doesn't come back. Right. So, I think we can assume at least that to a great extent their problem has been solved, and they can, it may not be perfect. They may still require kind of a normal amount of antiperspirant that a usual person might need, but that their major cause of their problems has been fixed.
Meredith, our time is up. You are the best teacher. I love having you on the show. You've got so much information. Tattoos can be removed. Over the normal sweating under the arm can be treated. And if we've got love handles, there's hope for us all. Thank you for coming. You're just a great teacher. Thank you.
Thank you.
Know that your dermatologist has the ability to change problems. Talk to your dermatologist and see if you're a candidate for those treatments. Now you're going to want to stay tuned. We're going to be talking about Parkinson's disease, and we'll be talking about chronic hoarseness. Cancer or not, how do you know? Hello, I'm Dr. Bob Overholt, here to encourage you and your family to get out and play in our Knoxville area parks. Knoxville has dozens of parks and more than 85 miles of trails. There are picnic shelters, ball fields, tennis courts, and disc golf courses, dog parks, fishing ponds, and skateboard parks, trails for hiking and mountain biking, boat rentals, you name it, Knoxville has it. To find a park or greenway near you, visit OutdoorKnoxville.com. And get out and play, it's good for your health. I grew up in an age where people really didn't have tattoos, but it's becoming a common part of our society today. As we watch athletes, frequently we see lots of tattoos that people have. When we go down to the beach, we see people with their bathing suits that have tattoos on their arms or on their back. So tattoos are part of our society today. I wonder sometimes if those people don't regret having their tattoo as they get older. Maybe it's embarrassing to their children or to people that are around. Know if you've got a tattoo, there are some things that can be done. New lasers are being able to remove tattoos, and that's what Dr. Meredith Overholt has talked about. If you've got a tattoo that you don't want and it embarrasses you, know that you can seek medical advice, and with that advice, you'll be able to remove that tattoo. It may take one setting or two settings or even three to remove the tattoo. But when you get it done, if that's what you so desire, it will improve the way you feel about yourself. I want to thank Dr. Meredith Overholt. Wonderful discussion on non-invasive, no surgery, skin care. Now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob. Why do people get Parkinson's disease? You know, it's in the news. Michael Fox has had it. Robin Williams had it, associated with depression in Robin Williams. So what is Parkinson's? There's a certain part of the midbrain, it's called the substantia nigrans. And when that area there gets to be a protein that deposits, and it leads to a pill rolling tremor that people have. Not a fine tremor, a pill rolling tremor, where it's usually in the hand and it will go like that. Can be the chin that's having that. Activity gets rigid, so somebody walks with a shuffle. They have poor balance and they may shuffle and keep on going forward. And sometimes they lose their sense of smell. If you start having any of those things, know that you should see your doctor, because if you see a neurologist who specializes in Parkinson's, they can give you some medicine to help replace the problem. It's dopamine. Dopamine caused some problems, so now they put dopamine with another agent to make it where that tremor and that spasticity goes away and the lack of expression that goes away. It's a progressive neurologic disease, but there can be treatment that help you along in the early phases. Question number two, Dr. Bob. I'm hoarse all the time. Could it be cancer? Great question. One of the signs of possible cancer is chronic hoarseness. So if you've got hoarseness and it persists, what could be causing that? Well, teachers, yellers, preachers, yellers get hoarseness. Sometimes they get little nodules on the vocal cord for overusing the vocal cords. Sometimes people with drainage from allergies, the drainage will cause irritation of the vocal cord area or the back of the throat, causes hoarseness that people have. Sometimes it gets worse in the morning and better as the day goes on. People with reflux, the reflux can come actually from the stomach into the back of the throat, where they'll start getting hoarseness there. We call it laryngeal reflux disease. So drainage can cause it. Reflux can cause it. Overuse of the vocal cord can cause it. Low thyroid can cause people to be hoarse. So if you have hoarseness, you can see your ear, nose, and throat doctor. He actually will deaden the nose. They do rhino nose laryngoscopy. So with a little tube, they go up and they look down at the throat. They can see if there's vocal cord nodules. They can see if there's redness there. They can see if there's cancer there that needs to be treated. They can see if there's reflux, and they can see the drainage. If you've got hoarseness like that, see your ENT doctor. That's all the time that we have for this show. I hope you've enjoyed it as much as I have, because I've had a blast. Remember, we've got to be exercising. We've got to be exercising 6-7 times every single week. Exercise will cut down on stress. It'll make you feel better. You'll get a runner's high. It will help you with your weight. It will help you with your blood pressure. You don't have to be a runner. Get outside, get those tennis shoes, and have a good time. Start the day off eating properly. We don't eat well in the United States. We've got to be eating better food. You've seen the better food in the news. But we know that we've got to eat more baked foods, more vegetables, more fruits. All of those will help you. 7.5 hours of sleep. We used to say 8 hours on the Dr. Bob Show. Now the Sleep Association say probably 7.5 hours. You'll feel so much better. You'll be happier. You'll smile better. You'll perform better. Be sure that you're sleeping well. If you're not, talk to your doctor about sleeping better. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Find somebody that you like to laugh with, giggle a lot, and sure enough, you'll be healthy.